this morning I'm going to be changing a colostomy on my patient. The first thing that I'm going to do is perform wipes. I'm going to introduce myself to the patient. I'm going to ensure his safety. I'm going to explain what I'm going to be doing, and I'm going to be, of course, washing my hands.
I have no idea.
See, that's my
idea.
I don't know how to mess with this iMovie stuff.
Knock,
What is
knock.
my response? What am I doing?
How are you? My name is Kristen.
I'm doing respiratory.
I'm going to be changing your colostomy bag today. Allison, how are you? I'm going to pull the curtain to ensure privacy for my patient. My patient is in a comfortable and safe position in bed. And I'm going to explain to her that I'm going to be changing her colostomy. So next I'm going to perform vital signs on my patient, routine vital signs. I'm just going to let you know, Allison, I'm going to be taking your vitals. So first I'm going to be taking her radial pulse for a full minute. Pulse rate is 78. I'm also going to take her apical pulse. In the 5th intercostal space at the apex of the heart for a full minute. No. I'm also noting the patient's respirations, which are 18, which fall within normal range. And I'm going to be taking the patient's blood pressure. I'm going to locate the brachial pulse. And I'm going to position the cuff 1 inch above where I located the brachial pulse in the antecubital space.
Okay.
We each get someone different. Like, if I shoot her doing number 1, she shoots me doing something different.
Yeah.
Okay. So you want me to do number 1?
Yeah.
So I videotape him doing that. Okay.
And my patient's BP was 122/76, which falls within normal range. I took an oral temperature of my patient, and the patient's is 98.6, which is normal temp as well. So again, today I'm going to be changing my patient's colostomy bag. I'm first going to do a focused assessment on the abdomen. I'm checking the order to ensure this is the correct person. Allison Alvarez in her order. It is for an ostomy care every shift, change pouch every 5 days. It's the 5th day, so I'm going to do the change.
Is not
I'm
indicated.
going to enter the patient's room.
So we'll just move on from there. I'll check his pulse. So I would grab his radial pulse.
Hi, Mrs. Alvarez. How are you? My name is Kristen. I'm going to be doing an assessment on you, your abdomen, before I change your colostomy bag. So I'm just going to pull the curtain again here, make sure that there's privacy. I'm going to expose just her abdomen.
And then I would times both by 2, and then you would have your
She's
respiration.
in a good position for my assessment. So first, what I'm going to do is auscultate 4 bowel sounds in all 4 quadrants, starting with the lower right.
Respirations are 18, they're regular and shallow. So now check his blood pressure. So making sure there's no IVs, if it was a woman, left vasectomy or anything like that.
I listened to all 4 quadrants. She's positive times 4 for bowel sounds. I'm now going to palpate her abdomen to make sure it's soft. Make sure that there's no distension, no hardness. I'm going to feel her for her bladder, make sure there's no distension.
Above that region, the artery.
I'm assessing the stool in the bag that's present. I'm asking my patient at the same time if there's any pain present whatsoever, and she's denying that there's any pain while doing this. Assessing the stool in the bag. There's a moderate amount of brown stool. It's formed, which is a good sign.
Blood pressure.
And next, I'm letting her know what I'm going to do. She's in a good position for this. So first, what I'm going to do is put on gloves to remove the old bag.
Put it right where the pulse would be.
provided my patient as much privacy as possible.
20 to 30 millimeters of mercury above, which is average blood pressure.
I'm going to remove
Keep going until you get high.
gently
And then you would slowly
the old
decrease
ostomy.
it until you heard the first sound. That would
Gently
be systolic.
assessing the skin
Going down,
as I go.
the pulse pressure disappears. That would be
I'm going to discard this properly in the trash.
Then his blood pressure would be 120.
And now I'm going to assess the skin around the stoma and assess the stoma. The stoma is a good size, it's the right shape, it's red, it's moist. The skin around is not red or irritated, which is good. So I'm ready to clean around the area.
And then the right documentation. Right, and the right documentation.
So now I'm going to apply a new colostomy bag. I've discarded my old gloves and I've put on new gloves. I'm going to clean the skin surrounding the stoma with warm water, noting the skin, making sure that the skin isn't red or irritated, and I'm going to wash around the stoma, making sure my patient's comfortable as I do with this. And I'm going to, with a new cloth, blot dry.
I could do it. I just didn't know what they wanted.
I'm going to start by checking them in
This is going in a linen basket. Next, I'm going to be applying skin prep to the area around the stoma.
It's going to go 3
Clean my
minutes.
hands, wash my hands. Then I'm going to
Can't
come
hurt
to
to
the
be
med card
overly
and I'm going to check for my patient's first and last name.
Around, careful not to get the skin prep on the stoma itself, but just the skin around it. It helps the bag adhere more. And while that's drying,
I'm going to check the orders.
I'm going to size the stoma for the correct place to cut. 1/2 of an inch, 38 millimeters seems perfect. So I'm going to size this. 38 millimeters is already marked on here for me, so I don't need to draw. I'm going to cut my colostomy to the appropriate size,
So I'm going to start by unlocking my
making sure not to cut through the bag, and making sure to have as smooth of an edge on the hole as possible.
So, it says that he ordered albuterol, and albuterol,
Yeah.
I'm going to check for the dose.
Alright,
Okay,
I'm going to
now,
remove the adhesive backing.
He has independently
See when is the expiration date.
sat up and gone to the
The
side
skin
of the bed.
prep is now dry.
So definitely.
I'm going to fit this over the stoma, and I'm going to position the bag in a place where it's going to be easy to clean and out of the patient's way and the most comfortable for them.
You also want to check his, while we're here, is
So I'm going to put it off to the side. It fits properly. I'm going to put my hand over the plastic adherent just to warm it to the skin a bit for placement. And I'm going to make sure that the adhesive is smooth and properly placed.
The right documentation and the right response.
And I'm now going to put the clip on the bottom of the bag. Everything's in place and fits well.
On my second check,
Patient's still in no pain and is comfortable.
and I'm going to
I want to make sure that when I put the clip in, I'm flipping the lip of the bag upwards.
name on the medication. I'm going to make sure
expose the chest.
that the
Have him
medical
take a deep
record
breath for each
matches
sat, for
and the
each
date of birth
position.
and
So I start at the top
for the
and first intercostal space.
Okay?
Have him take a deep breath, exhale.
And I'm going
Then
to
move over
cover
to
my
the
patient,
side.
and I'm going to let the patient know that I'll be back to check the drainage and the colostomy, and to check on the stoma to make sure everything is in order.
Make sure that there's no other medication or any other things.